Now, I assume that the groups meet at all different times of day, and
They
we can
do.
find that on your website, which
They
of
do.
course we'll provide later in the program.
We
Okay.
also have a calendar. I brought a copy with me,
Okay.
which comes out every couple of months,
Great.
and it lists all the highlighted programs, and inside there's a calendar for those
Okay.
2 months, so people can read that, and they can get that on the website as well.
And individuals, do you mail those out as well?
If people
someone
call and
wants
say
to
they
be on
want to
the
get
mailing?
it, yes.
Okay.
Yes, we
Great.
have a mailing list, yeah.
Okay.
So just to complete the brief
Right, so that's your support
description,
groups.
well, there's actually a couple more.
Okay.
Caregivers, who are folks who often, when a loved one is ill, whether it be cancer or otherwise, the focus understandably is on the patient. But caregivers have such an additional stress
Right,
of being
absolutely.
supportive that we offer groups for the caregivers alone to be able to have a place to be able to be with one another and be able to recognize that they need to focus on how they're doing, because if their health isn't good and their emotional well-being isn't good, they're not going to be
They're
as
not gonna be
effective in
much
their
help.
role. And then
Sure.
the bereavement groups. And then one other group I want to highlight are what we call our Kids Connect, Parents Connect group, which is for children and parents. So children who have a parent going through cancer, and children anywhere from 6 to 17. Once a month we meet on a Saturday morning, and we run groups for the kids and group for the parents, so that the kids can feel that they're not the only one
Alone,
going
right.
through this, because you know how kids are. They don't want to feel like they're different in any
Right,
way.
of course.
And here's a place where they can meet some other kids whose parents have cancer. And not that they're going to sit there and talk about cancer the whole time.
Of course,
They're going
right.
to play. They're going to have, again, with a facilitator to be able to guide the discussion and the activity. And the kids find that very, very helpful. And the parents do too.
Sure.
For parents whose child has, for a parent who has cancer, concerns about, is my child's behavior age appropriate, or does this relate to my illness? And if it's your only child or your first child,
You don't
you
know.
have a young teen who's
Right,
acting
you don't
out,
know.
gee, is that just because they're a young teen? Or
Right,
is that because I'm
right.
dealing with my cancer? So we have many, many types of
That
groups.
sounds wonderful. That's
Yeah.
such a great community resource.
Yeah, thank you.
And you mentioned there's the mind-body
Right.
technique. Are these exercise programs, or
So,
What are
so
those about?
mind-body, which another way to describe that would be stress management. So
Okay.
they encompass, the mind and the body. The mind would be, we have a weekly meditation class, we have a relaxation and visualization session. We have something called wellness workout, which is some gentle stretching.
Okay.
We have several yoga classes to focus on really the physical aspects of healing, as after someone has gone through surgery or any other kind of chemotherapy, radiation, there is immediate effects of the treatment that may make someone feel a little bit weakened,
Okay.
and they also may feel that they just haven't been able to be active,
Right.
or even more so, like the doctor was mentioning, we may also be looking at lifestyle changes, so to be able to begin a gentle exercise program and then graduate
And
from
then
what we
move on
offer
from there,
and move on
right.
to more vigorous activities.
Excellent. It sounds it's like such a very comprehensive approach, not only in terms of addressing the needs of the whole family or the
Right.
community that surrounds the patient, but the whole person as
Right,
well.
Right. There's one other piece just to mention briefly, and that's
Sure.
the education side, and
Okay.
where we bring in, once a month, we bring in a registered dietitian who works in the different area cancer centers. So these are registered dietitians who have expertise in cancer. From Somerset Medical Center, from the Cancer Institute, from Hunterdon Medical Center.
Right.
They volunteer their time, and once a month
Wow.
they come and give a talk, lead a discussion really, on a topic relating to nutrition and cancer, so that our participants can come and really gain that knowledge to feel that they're a little bit more empowered, because that feeling of being out of control in an experience like this is huge.
Terrifying, I'm sure.
And so nutrition is one place
Right.
where I think people often feel they can make some changes, just like exercise,
Right.
nutrition and exercise. So nutrition is a big part of our educational programs. We have a whole variety of other educational workshops,
Okay.
many of which take place at our facility. We'll invite in doctors, nurses, social workers to come in and do talks on various topics. But we also do educational programs at some of the area hospitals.
Okay.
We're doing one in a little while at both Somerset Medical Center and Hunterdon Medical Center in the next couple of months.
Oh, great.
And
Is
just-
that information on your website?
It
where
always
we
is.
can
It always
okay.
is. Yeah, yeah. We have them on various topics, whether it be a specific type of cancer, or it be on just treatment side effects.
Okay.
So we collaborate with the physicians at the institution. They are the presenters, and we come in and we work collaboratively with them in putting on those programs.
Okay, great.
We rely on
And-
those folks to make the referrals to us. So we
Right.
really pride ourselves on trying to have as good a relationship as we can with the doctors and the cancer centers,
Sure,
so that they
and-
will use us.
Right.
A lot.
Right. And the fact that the programs are free, I
Yes.
think that's really essential to reiterate that for viewers.
Mm-hmm.
And so, Dr. Harmon, you are familiar, obviously, with
Absolutely.
the wellness community. And do you see the benefits? What are your thoughts on that?
I think it's very important. I think that education is very important, awareness, but most of all, support. Because when someone's been diagnosed with, let's say, prostate cancer and is undergoing treatment or has recently undergone treatment, it's important to have that support and from other people who have been going through the same thing, and the support for your family and for your children is mentioned. I think it's a very important point because it's not just a physical illness, it also can affect one emotionally.
Right.
And it's important to have that support because with more support and being emotionally stronger, one often does better clinically. That's very, very important
That's a
because it's
very
mind and
critical
body.
connection to make. And again, it's not treating just the patient with medication, with treatment. It's that whole person.
Right.
Excellent.
Absolutely.
Well, thank you both so much for joining us today. It was very informative, and I think I have to say, men in general, I don't want to make a total blanket statement, but are not always so inclined to go for the kinds of support that we know are so valuable. So we have to encourage men to take part in those things, whether it's early stages, whether you're post-treatment, whatever that may be. There's certainly a place, it sounds like, for someone at the wellness community. So thank you both so much for joining us. And we'd like to remind our viewers that all of the resources described here on today's program will be available on the Middle-brook Regional Health Commission's website, and that is www.middlebrookhealth.org. So please take a moment to take a look at that. And we also would like you to just take 30 seconds or less to complete an online survey. We'd really like your feedback about public health matters and suggestions for future programming ideas as well. Again, that is available on our website, and you'll see that right on the home page. It's a very easy link and a very simple feedback form that we ask you to complete. So thanks very much for watching Public Health Matters.
Man, you gotta love them. Sometimes they just don't want to know. Take my husband. All I said was, pass the sugar, and hon, did you know that 1 out of 7 men get prostate cancer? Oh, I could feel him tense. So I added, the good news is 95% of prostate cancer is curable if detected early. But he missed that part. He'd already buried his head in the sand.
Don't get scared. Get tested. Talk to your doctor.